Good afternoon, everyone, and thank you for choosing Across the Fence. I'm Will Michael, in for Fran Stoddard. You've likely seen or heard the news that the American Red Cross is experiencing a severe blood shortage, and they're urging donors of all types to give as soon as possible. Today, we're going to learn why this is happening, what the impacts are, and what you can do to help save a life. So joining us this afternoon are two guests. Jennifer Costa is the Regional Communications Director for the Red Cross of Northern New England, and Dr. Sarah Harm is the Medical Director of the UVM Medical Center's Blood Bank. And I want to thank you both for being with us this afternoon, and I hope all is well. Jennifer, let me start by saying this is being called a severe blood shortage with an urgent appeal for donors. Do we know why this is happening?
Yeah, so I'll just start off by saying, the need for blood is truly constant. Every 2 seconds, someone in this country will need blood. Blood is one of those things that it can't be manufactured, it can't be stockpiled. And so what is happening right now is there's kind of a perfect storm of circumstances going on. So as we're starting to come out of this pandemic, hospitals across the country are getting back to business as usual. And so that means scheduling more elective surgeries, but we're also seeing something a little bit different going on here, and that is more trauma cases presenting at hospitals. And that could be more ER visits, and those patients unfortunately require a lot of blood. A trauma patient coming in to an emergency room can need upwards of 100 different blood products. And so, compared to 2019, what hospitals across the country are seeing is about our demand anyway from hospitals, trauma centers have gone up about 10% for their demand for blood products. And then we're seeing something else go on. We're also seeing we've been in this pandemic for more than a year. And what we know is that some people deferred care. So now that we're coming out of this pandemic, we're seeing patients present to hospitals sicker. Some have later stage disease progression, and that's also requiring more blood. And so all of these things together is putting more stress on the blood supply. Over the last 3 months, to give you kind of a snapshot, the Red Cross nationally has distributed about 75,000 more blood products than expected. And so to meet that need, we are seeing this shortage, and it is a severe shortage. And that means in some areas that hospitals are having to put off some patient care and some of those elective surgeries.
And going back to what you said at the top of your answer, one of the key points is the perishability of the particular product that we're dealing with. Blood is a perishable product, and you rely on these generous donors to be able to do that. So as a follow-up, preparing for this program, you helped me understand just how significant an individual donor can be. Can you share with our viewers what you explained to me?
Sure. So blood is perishable. Red blood cells have a shelf life of 42 days, platelets 5 days. So the Red Cross needs to collect 12,500 pints of blood every day to meet hospital demand across the country. So what does that look like in Vermont? Let's bring it down to the local level. So right here in our state, we need to find 80 people a day, collect 80 pints a day to meet our local hospital demand. So when you look at the numbers, that's 560 unique Vermonters each week that we need to roll up a sleeve and donate an hour of their time and a pint of their blood. And then you need to remember that those 560 individuals won't be eligible to donate again for 8 weeks. So you really start to see the numbers there and the incredible field we need to have of folks who are generously willing to roll up a sleeve and donate. And so right now we are running in Northern New England about 10% behind. And so that roughly translates to, in addition to those 560 donors a week, we need an extra 8 donors. And just something, an important statistic I like to throw out there is, I mentioned at the top that every Every 2 seconds, someone will need blood, yet only 3% of people in the US donate blood. And so even a small uptick in the percentage will go so far in saving lives.
So what do I need to do to donate blood today, tomorrow, or a few days down the road? What do I need to do?
We like to make it really easy. So all you need to do is, if you have access to a computer and it's right there on the screen, you go to redcrossblood.org. When you get there, you'll be prompted to just type in your zip code. You type in your zip code and up will pop all of the blood drives in your area. We also have our fixed site, our donor center, that's in Burlington. Or you can call 1-800-RED CROSS. What we're asking people do is to make an appointment. It is really critical that people make an appointment. It allows us to manage the flow of patients, but it also allows us to have a sense of who we have coming in to make that blood supply a little bit more predictable.
That's perfect, Jennifer. I do want to bring Dr. Sarah Harm into our conversation. As I said at the beginning, Dr. Harm is the medical director of the UVM Medical Center Blood Bank. So what role does the blood bank play, Dr. Harm, in making sure patients have life-saving blood?
So the blood bank at University of Vermont Medical Center, our sole purpose with all the technologists that work here 24 hours a day, 7 days a week, is to supply safe cross-matched blood when we can to the patients who need it, whether that be patients in the hospital or patients coming in who are trauma victims from outside in the ED.
Do you work with the Red Cross to accomplish the things you talked about?
So the Red Cross is our primary only blood supplier. So all of the blood that we have at the University of Vermont Medical Center comes from the Red Cross. So we are completely reliant on them for all of the blood for every patient that comes in.
So can you give us a sense of what this blood shortage, this severe blood shortage means for the blood bank and perhaps even more importantly for Vermont patients?
So any blood shortage, whether it's severe or not, affects the amount of blood that we have on our shelf that's available for us to test for patients. And so when there's a shortage, we just have to learn how to manage the inventory that's a little bit smaller than what we're used to. And for normal daily hospital use, that's okay. The thing that's the problem is that we're the trauma center, we're the only trauma center in Vermont. So severely injured patients have nowhere else to go except to the University of Vermont Medical Center. So it's our responsibility in the blood bank to make sure that we have enough blood in case there are traumas, and that's the tricky part. You never know when the traumas are going to come in.
So I don't want to ask it, but what happens if you don't have enough blood?
If we don't have enough blood, we can't treat those patients. Like Jennifer said, there's no substitute for blood. You can't create it, you can't make it, we can't manufacture it. We're completely reliant on generous donors that routinely come out and donate blood. And the University of Vermont Medical Center is completely reliant on the Red Cross to provide that blood for us. So unfortunately, if we don't have enough blood, then there's no other treatment to give these patients.
So some of the elective surgeries clearly need to postpone, and it creates a not obviously a good situation for trauma patients. That's I guess the bottom line. Dr. Harm, we've heard about blood shortages before. Is this one different?
This one feels a little bit different from the hospital perspective, simply because it seems to be lasting a lot longer than they usually do. All hospitals who have blood banks are used to periodic shortages in inventory, but they seem to only last a few days and we can weather that storm. But this time it seems to be lasting a little bit longer.
I think Jennifer used the term the perfect storm, the pandemic. Return of elective surgeries, increased trauma. I guess, did I get that right? Are those kind of the big three that's taking place?
Yeah, and I would I would say that summer is always a challenging time on top of the other elements that you just mentioned for the Red Cross to collect blood, because it's not as top of mind as it would be during other times of year. We're competing with school vacations, and just now with the pandemic and people who haven't seen loved ones in over a year, and being able to get back to that, we're finding it challenging to get people to make appointments.
Jennifer, you've talked about the importance of all the time. Okay, we're in a severe shortage. We need emergency appeals and we need help, but there's always a demand for blood. Is there a demand for a particular type of blood?
As you mentioned, there's always a need for all types of blood, but right now in particular, there's an emergency need for type O blood and those giving platelets. And why is that? So type O positive is the most transfused blood type, and then type O negative is what your viewers might have heard of, the universal blood type. So that's the blood type that the hospitals and the emergency room physicians and staff will reach for first when a trauma case comes in and there's not time to figure out the blood type of that patient. And like I mentioned before, a trauma patient can need 100 blood products, 100 units of a blood product. And so those O donors are so critical to meet that demand and make sure that that universal blood type is on the shelf when it's needed. And then platelets. So platelets are the clotting portion of blood. They are used predominantly by cancer patients, and they only have a shelf life of 5 days. And very quickly, I'll share a story. I was just talking to a mom in Winooski this week, and her son was diagnosed with leukemia in February. And he's had upward of 30 transfusions since his diagnosis, and they've always been able to get platelets when they need them. And this past week, they went in and they were told for the first time, you have to wait. And so she said it gave her that parent anxiety. Luckily, they only had to wait a matter of hours and not days, but it goes to show you what we're talking about here and who we're really collecting this blood for.
It goes to show you that an individual can make a difference in the case of this family from Winooski that you just shared. So before we go, I want to make sure everybody knows today how they can donate blood. What do they need to do?
Again, just visit redcrossblood.org, or you can call 1-800-RED-CROSS and make an appointment. And please, 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 if you make an appointment, stick to the appointment because we depend on it. And the other thing I will mention very quickly is that we actually don't want hundreds or thousands of Vermonters going out and trying to make an appointment this week, because the blood inventory, the blood system wouldn't be able to absorb that. What we are looking for is sustained giving throughout the summer. So if you go and you try to make an appointment and you don't immediately see something, that's actually good news. That means your neighbors have stepped up, filled those appointments, and just continue to check back throughout the summer to try to book later on when maybe the headlines go away, but the need will still be
Jennifer,
there.
thank you. I do need to stop us as we're out of time. I want to thank you both for being with us this afternoon and these important messages. That is our program for today. We know you have choices, so thanks for choosing us. I'm Will Michael, inviting you to join us back here each weekday afternoon for another visit Across the Fence.